both the needle are lactide caprolactone threads. They are desorbable, and we know that they act based on two different actions: the lifting action due to the repositioning of soft tissue, and this is the mechanical action, and then thanks to the fibrosis that appears along and around the thread, we have also the delay action, the revitalizing action. So it's very important to remember that we have a bidirectional convergent barbs, and it's important to remember that when we have the specific distribution of the barbs, usually we have a accumulation of soft tissue towards the central part of the thread, and this is very important to remember, because we have to put the central part of the thread where we want the maximum accumulation of soft tissue. And again, this is fundamental when we plan the insertion.
Hello. Hello, everyone, and Dr. HAU. It's a pleasure for me here tonight to speak to you about Kacey Asia. Just a little bit about me. I'm Dr. LAM Kar Wai Phoebe from Hong Kong, surgically trained and worked in New Zealand, Scotland, and Hong Kong. Apart from thread lifting, most of my work area also in aesthetic surgery during BLEF, rhinoplasty, and fat grafting. I think in the past, trying to keep up with the rapid changes in our field of aesthetics, we must travel far across the world to participate in these inspiring discussions. I think it's great now that we're able to meet online to discuss and share experiences. Well, tonight, my topic is actually on the risks and benefits of different thread surgery systems. But hey, how many systems are there on the market? I think most of patients want to deal with the faces without too much discomfort and downtime.
And this was already briefly talked about by Dr. Lam, and I'll just skip on some of these threads that were mentioned earlier. So we have the NCOGs. This is the first generation polydioxanone or PDO threads. Now, recently introduced in the country is the Silhouette Soft, which is made of PLLA. And of course, we have the Mint thread from South Korea. And of course, the one that we're all familiar with is the Happy Lift in the Philippines, still named the same. But in other countries, it's now named as Stephanie's threads. This comes in a 12 and 23 centimeter barb threads. And this is the composition, as was earlier discussed by Piero.
So ideally, the cog should only play a role during the procedure. And after the procedure, the lifting state should be maintained by the mesh with adhesion. So cogs act as an just assistant so that the tissue adhesion through the mesh pore happens quickly after the procedure. Thus, the pressure on the cog gas is purged to the mesh that surrounds the entire central thread. Considering the tissue regeneration and biocompatibility, at present, the use of the mesh scaffold seems suitable as observable lifting material. And the size of the pores must be properly spaced. These are concepts to recognize the tissue ingrowth through the mesh pores. The first is boundary linings, in which tissue recognize the mesh lining as foreign substance and encircle the perimeter as the mesh pores and cause tight adhesion.
Superficial fat is in this layer. So thread mandatory should be inserted in this area to avoid some complication as performed before by some speakers. And then the second thing is about skin itself. During aging, skin will lose a significant numbers of fibroblasts, who is responsible to produce extracellular matrix fibers, including collagen. So these extracellular matrix fibers are responsible to support the skin tissue. And of course, because of the loss of the fibroblasts, reduce the production of the collagen, of course, the skin become loose and need something to replace the support system of the extracellular matrix fibers, which is one of it is using thread due to the collagen, new collagen formation. And then the third important thing is about retaining ligament. So retaining because of the...
So I'm from Hong Kong, been working in different places, and let's move on. I think one of the major challenge of nose thread is, especially for the beginners, the thread companies market nose threads to be an easy to pick up procedure, which I totally disagree. So if you encounter all the marketing material, mostly would have a very simple explanation on how nose threading is. But I think the complications or the incidents where you encounter problems with nose threadings are far, far, far more than the face threadings. So just very briefly on the possible complications, discomfort and pain, bruising, swelling, dimpling, irregularities, visible threads, infection, protrusion, and lastly, expectation mismatch.
System. And just bear in mind that this is a highly unregulated area in our aesthetic practice. And as a responsible and ethical physician, the first #1 thing is do no harm. And this is what we learn from here from all the experts tonight. I'm sure that SciAsia is a wonderful platform, and Patrick Wang has done a wonderful job in the past few years amid the COVID. And this is a very, very useful learning platform for all the incoming doctors and even for the experts like all of you. So please spread this message to your fellow colleagues and invite them to join SciAsia. SciAsia is getting a notable presentation in IMCAS in